here at Riverside Diagnostic Center at Oyster Point, learning all about being an X-ray technician. And Brandy is here. Brandy, what exactly is an X-ray tech?
An X-ray tech is a radiologic technologist that takes X-rays of people's anatomy to show if there's something wrong with their body, if they get hurt.
Well, tell me a little bit about your background on how you became an X-ray tech.
I went to a community college for a year, and then I got accepted into Riverside College of Health Careers for their X-ray program, and then I did that for 18 months, and then I had to take a national test, and then once I passed that, I was able to start working here as an X-ray tech.
And Brandy, besides X-ray tech, what are some of the other career opportunities in this field?
The career opportunities here at this center are CT or CAT scan, MRI, mammography. They have bone density and echocardiology, so there's a lot of opportunity within the imaging field.
And are all those under one roof here at Riverside?
They are. Mm-hmm.
So I understand we have an actual humanoid that is going to help us out, and we're going to demonstrate some of the equipment that you use.
That's correct. His name is Daniel. You can come on in.
All right, Daniel, come on in. So we got Daniel, he's in position. Now, was there any prep that he needed to have done before he gets to this point?
Not for this X-ray, just besides taking off his clothes, but dependent on what procedure is being done, there are preps that people do have to do when they're here.
What is this machine?
This is a fluoroscopy machine. This is what we use for procedures, but we're going to be using that tube right there. That's my X-ray tube. This is what we use to take X-rays.
That's called a tube?
Mm-hmm.
Looks like a giant camera.
Yep, it sure is. It sure is. And then right underneath here is our actual receptor. This is where the picture actually is taken. So the X-rays come out of that tube and shoot through the patient and onto our image receptor right here.
All right, so you want me to grab this machine here?
Yeah, I'll show you. I'll show you.
All right.
So we press these two buttons right here, and it moves the whole machine.
Mm-hmm.
And we're gonna kind of move it over his abdomen.
All right.
So I'll let you move that. Daniel, close your eyes.
Oh. You have to press this button right here?
Both of them, yep, with your thumbs. Yep,
Oh,
and
I
then
see.
drag it this way.
Golly, I'm already breaking a sweat. Oh, that's a little low for your abdomen. Sorry. Okay, here we go.
Good.
All right, so it's in position. I can see clearly that you're in the crosshairs.
That is correct. So then we have to line this up. This is our image receptor. Okay. So we pull this out. You see this line right here?
Yes.
We're gonna move this knob and push it this way.
So it lines up with that.
So that it lines up with the red.
All right, and we've got everything lined up here. So what is the next step?
The next step would be to find out his name and birthday and ask him what his symptoms are. And then once we have all that information, we are gonna go ahead and give him some breathing instructions and go behind that lead line panel and take a picture.
You make it sound so easy. What's the name of the panel?
It's a lead line panel,
Lead
so
line.
it protects us from getting a lot of radiation dose because we're constantly in the field of radiation.
And Brandy, what do you do once you get behind the lead glass?
I make sure that all my technical factors are correct for exposing this patient to radiation, and then once everything is correct, I literally expose the patient and tell them to hold their breath. Once everything is complete, I let my patient off the table and they can go.
And so we have the image, then where would it go from here?
I send it over to my PACS imaging system, and the radiologist has the opportunity to read it at that point and then give a diagnosis to the patient and the patient's ordering physician. Just a few months ago, I decided that I would like to cross-train into mammography, and it took me about 4 months. I just ordered my own books, did on-the-job training over in the mammo department, sat for my registry back in February, and have been doing it ever since full-time.
So once Riverside sees that you want to move up in your career, how do they come along and help you do that?
If they have the career opportunity available, you are able to apply for it, and then at that point, they're going to help you get the things that you need to study and sit for your registry. And then once you sit and you pass, you're able to do more with your career.
Gotcha. So you're not on your own, but the company's coming behind you to say, hey, we're excited too. We're going to help you get to the next
Yep,
point.
and they support you for sure.
Brandy, thank you so much for letting me take a peek into your workday here at Riverside.
Absolutely.
And thank you, Daniel. You did great. If you'd like more information about this career and more, check out riversideonline.com/careers.